Hi, my name's Seb Grab. I'm a paediatric consultant and children and young person asthma lead for Bath, North East Somerset, Swindon and Wiltshire. I'm here to talk to you about making every contact count for children and young people with asthma. Most importantly, we need to get the basics right. So every time a child is seen with asthma, we need to focus on the basics. Get individualized prescribing and make sure they have a personal asthma action plan. Ensure they nail down their inhaler technique, including use of spacer if they've got a relevant device. Structured annual reviews really help, and in that, identifying triggers, addressing any comorbidities, and checking adherence. For the other things, I like to use the HEADS assessment to remind me of what to focus on. H is for the home environment. Explore whether there's any damp or mold to avoid the awful situation that happened to our Bishab when he died from mold exposure. House dust mite interacts with asthma. It's really important to address this and give advice simply about how to avoid house dust mite as much as possible. And then there are other soft and cuddly allergens which may need avoiding if they're present in the home and playing a part in asthma. E from the HEADS assessment is education setting, and there's a big drive to try and make asthma schools as friendly as possible so that everyone who comes across a child or young person with asthma knows what to do and how to do it. A is for activities. No child with asthma should suffer and not be able to partake in the normal activities and have an active lifestyle. Air quality is unfortunately playing a bigger and bigger part in asthma management, and being aware of the daily air quality index to allow children and young people to plan for what they can and can't do based on the air quality is really important. D is for drugs and drinking, both of which can play a part in asthma control. S stands for lots of different things. Smoking, and increasingly more important in young people, is vaping as well, and the use of e-cigarettes. Social, are they able to interact? Are they getting peer pressure to partake in smoking and vaping? Sleep, we know, interacts particularly with health and can impact on asthma. And stress, which is a trigger in itself and can culminate in a vicious cycle, all of which need to be addressed. Get the basics right. Think about the HEADS assessment. Every time you see a child or young person with asthma, try and make every contact count. Thanks for listening.